Good morning, everybody. So we have a panel that's going to focus on the national pieces, but we're going to start with a little bit of California context, just because we're California and we always have to do that. I feel like it's my job when I go to a national meeting just to make sure they understand a little bit of California, especially when the person sitting next to me often has 800,000 people total in their state. So just some of that. But there also is a lot for us to learn. So we will start. Oh, the clicker might help. Thank you. And we'll see if I'm talented enough to actually make this work. All right, so I think they said the bios are all in your program so that we don't actually have to read those, but we will do a quick introduction and then jump in. So Sarah Neville Morgan, I'm the Deputy Superintendent of the Opportunities for All branch at the California Department of Education. And we call ourselves the Fabulous Five because we're OFAB, and we have 5 divisions: early learning, English learner support, expanded learning, nutrition services, and special ed. So when we think about opportunities and equity, we are equity in action in the department. And every single day, my message to the superintendent is start early, make sure we're talking about bilingualism or multilingualism and multiliteracy, and make sure it's full inclusion. So all of those are like our message moving forward to ensure that our children all have equal opportunities, as well as the fact in the educational realm that if children are hungry, they're not going to learn. If they're experiencing homelessness, foster care, other things, they also are going to be challenged learning. So making sure that that's brought into every conversation. So Mandy, do you want to go next?
Sure. Hi, I'm Mandy Sorge. I'm the Senior Policy Analyst for Early Care and Education at the National Governors Association. Thank you to Advancement Project for inviting us. I'm excited to be in California. You guys may know, under the previous administration, National Governors Association is a member association. So we didn't have a chance to come to California before, except for through Sarah and through the Education Department. So excited to be here and be working with the Governor's Office.
Hi, my name is Carlise King. I'm the Director for the Early Childhood Data Collaborative in Child Trends. Thank you again to the Advancement Project for investing us. We look forward to sharing our best thinking around early care and education and how we can better promote equity.
Hi, I'm Dana Hepper. I'm the Director of Policy and Advocacy at the Children's Institute in Oregon, and we are really excited to share the huge success we had in Oregon this year in hopes that it inspires folks across the nation to ask for what kids really need.
All right, great. So we'll get started with a little bit of California setting and then move into the sort of more interesting part, the rest of the country. So knowing who California's children are is always important because that's why we're all here. We're here to make sure that our children are served, and those demographics look different than they did 10 years ago and different than they did for sure 20 years ago. But I've also heard, as goes California, so goes the rest of the nation. So our demographics are foreshadowing to other states in the direction that they're headed. We are extremely large. We have 6.5 million children under age 13. That is definitely bigger than quite a few states. 3/5 of those children live in families where their parents work or are in school, hence the need for care. And the majority of them are children of color, with 52% being Latinx. That means that diversity is just part of our norm. 2.4 million of our children are eligible for subsidized early learning and care. That's 37% of our total are eligible, and we serve just around 410,000, or 17%. I always want to couch that, though, with California is extremely generous in who is eligible for subsidized care. Far more generous than other states in that we address state median income at the 85th percentile, and a lot of other states cap that at 30% or around there. So we are more generous in who's in the eligible category. 60% of our children live in families who speak a language other than English or English and another language at home when they're birth through 5. That means we are a dual language learning state and can capitalize on that as an asset. See if I do it correctly. So where are our children? If you look at the children in the subsidized early learning and care system, the majority of them are in center-based programs. About 68% are in center-based, 21% in family child care, and another 11% in license-exempt home-based. So looking across, the column This is where I need my UC Davis former pointer. But the first column is infant toddler, and you can see it's about half and half center-based versus home-based. The preschool one is majority center-based. That makes a lot of sense when you think about the California State Preschool Program and where children would be. The next one, school age, actually has the highest amount of children in license-exempt home-based settings. And so if you think of the majority of their day being in school and then needing evening and weekend care as well, that starts to make sense as you look at who is available to offer those non-traditional, more variable schedules. Next, how well are we doing with the same children who are represented as eligible for subsidized early learning and care? I can say we're not doing as well as we would like to be. So looking at the performance on our Smarter Balanced California dashboard, and if you're not familiar with the California School Dashboard, you should be. We should all be looking at it to really indicate and partner with our local school districts and county offices of education to best partner up quality early learning and care with schools to really support them in addressing these gaps. So a lot of our children are still in the underperforming groups, in those reds and yellows. So having a new state superintendent of public instruction meant a new commitment to early childhood, to children, and to a more diverse perspective around school and education. So in that, Tony Thurmond, our new superintendent, launched 13 work groups that really wanted to address the achievement gap. Now, we've tackled the achievement gap for years, but I don't think we've seen it narrow enough to actually say that we can be satisfied with where we've gone. So in that, Tony wanted to really look at 4 main categories: statewide literacy, and in that I always add next to him biliteracy, and home language development when you're starting early, reducing chronic absenteeism, which really means how do we ensure our children are attending their programs and their schools? How are we addressing things like suspension and expulsion? And through that, looking at implicit bias as well as trauma-informed practice. A lot of our children are in communities and families that have a whole host of other issues going on and need that surrounding support to address behavior and mental health needs. And then looking at a teacher pipeline. Tony's going to be here tomorrow, so he's going to address some of this more. But as we look at who our teachers are and how we best support them, and how children see themselves reflected in the teachers in their classrooms and programs, also is critical. And lastly, making sure that our students are prepared for the future of tomorrow around STEAM. So I only have 2 slides left, promise, but I wanted to quickly talk on equity in action. Everything all of us in this room do is around equity, but one of the spots that I'm committed to bringing up in every single conversation I have is how we're partnering with the tribes. As we look at Native Americans in California, we actually have 109 federally recognized tribes in California. So when I hear from partners that they don't think they have tribes in their local communities, you do. They're there. There's 109 of them across California. We have the largest Native American population in the country, with 12% of people who recognize themselves as Native Americans living in California. And some of the inequities across the years have really led to historical trauma. And our need and commitment to best address that and partner with them so children from tribes can also succeed and thrive is very core. So lastly, and this one sets up our 3 panelists in some ways, the Preschool Development Grant. So we're in what they're now calling the initial PDG, which is an interesting term because there actually was one before this. So I'm not quite sure how this is the initial. It's really the second. But we're in that, and we're about to submit our strategic plan and needs assessment. So thank you to all of you in the room who participated in those activities and gave us a lot of feedback. At the same time, we're writing for what they're calling the renewal. And the renewal is actually for 3 years, so far longer than the 1 year we got for the current. And California is eligible for up to $45 million. So a significant amount of funds when you're thinking about bringing additional resources to address some systemic change. There are pieces around governance, and we can think through alignment across our assessment. There's things around data. When I go to federal meetings, they give me a hug and tell me that I live in a data desert for early childhood. We know for years we were held back in our use of data and our ability to actually have and invest in data systems. So how is that there? There are priorities for infant and toddlers and for children with disabilities. Great, Bring it on. We love those. Our legislature and the governor have invested pretty heavily in those over the past couple years, so we can highlight some of our strengths even while we do better. So I'm gonna tip that off to all of you. That's our California context, but I do wanna hear some of your thoughts at the end around preschool development grant and what can California do? And from all of you, what do you think we can do to really address some systemic change around early learning and care? All right, so I think as we go in, Carlise, you are the first panelist. So my opening question to you, do you need this, Carlise? Oh, yeah. Otherwise, I can just keep clicking for people. It's the big green one. Yeah. With your national work currently and your past work in California, can you share a national overview on equity issues in early childhood and let us know what the data is telling?
Thank you, Sarah. So in thinking about equity issues in early childhood, I think we first think about access and really thinking about how we can implement strategies that remove barriers from families and replace those with supports. And so what I wanted to share today was a definition. Child Trends was funded by the Office of Policy Research and Evaluation to work with national experts to think about and define, well, what do we mean by access, right? So we have a lot of conversations, and sometimes we're talking with each other, sometimes we're talking past each other. And one of the key things is that we can't have equity without good data. And so with good data, we have to have some agreement about what we're measuring and what that means. And so I wanted to share this definition with you and then to point out some key areas where nationally states are looking to measure and identify ways that they can better increase equity and reduce disparities in different areas of access. And so I have on here a working definition that I'll share. And I say working definition because I'm already editing it as I'm talking to you. So access to early care and education means that parents with reasonable effort and affordability can enroll their child in an arrangement that supports the child's development and meets the parent's needs. And this definition has 4 dimensions to it. And I would add, regardless of that child or family's race or ethnicity, regardless of their economic status, regardless of where they live, regardless of the languages that they speak, regardless of their immigration status. I think we need to be thinking about that access for everyone needs different things and needs to be adjusted based on the needs of the children and the family. And one of the key things about this definition that I think is really important to emphasize is that it has both a child and a parent focus. And then the growing focus on childcare as a 2-generational approach to supporting families. And so I'm gonna share some national data and go a little bit through the different definitions. So reasonable effort is really looking, I think typically when people are talking about access, they talk about supply. But even with adequate supply, if a parent can't afford the childcare in their community, there's no access. If you have unlimited supply and that parent has a subsidy, it may not be affordable if that subsidy doesn't make up the full cost and the parent can't make the difference. Our National Center on Research on Hispanic Children and Families found that even with subsidies, 1 over 3 in 10 families, Latino families, found childcare cost unaffordable. And that really looking at whether even with a subsidy, that parent can afford and access the type of care that meets that child's needs, as well as the parent's needs. And so one of the other things that we've seen nationally, we recently did a survey of states on how they use their increased federal funding. And we saw 44 states and territories use those funds to increase rates for providers because historically those rates haven't been keeping up with the market. But we're also seeing affordability is not only about the rate that's paid to the provider, but it's also about what it costs to provide quality. It's about the parent contribution, and we're seeing that states as a future priority are also thinking about the co-payments that parents pay and how that may be a barrier to accessing the type of care that that parent needs. For supports to child development, I think that's where we get in these questions about quality, and we get in these questions about whether there's the types of care for families that may be experiencing homelessness, and the training and the support that we give to providers to provide that type of care. We're talking about children and preschool suspensions. We know that 47% of Black preschoolers are expelled, and this is starting early, and it's a trend that we see in lifetime suspension rates, with 45% of Black children, and then also, I'm going on time. So I wanted to share a few examples from the definition and then meeting the parents' needs. So again, we know that families that work multiple jobs or non-traditional hours, you could have a subsidy, you could have the supply, and a child cannot get to a child care program without their family, right? So it's to say that these dimensions are equally important and overlapping. Two stats I wanted to share with you guys that we looked at was in terms of looking at eligibility and access by race and ethnicity. You'll see here that we found that in California, comparing with other states, 65% of eligible families for a child care development block grant, and we saw that slightly less, 58% were served. But as I was mentioning before, even with the subsidy, is that accessible? The second piece, in terms of parents having the information they need in the process to access care, that with reasonable effort, it should not be difficult for parents to find and locate and access childcare. As was already mentioned, families have many different things that they're balancing, and we want this to be a process where parents can identify and easily find care. And so part of it is sitting back and looking at potential barriers. And one example was that we looked at states that had Social Security numbers that were required, that were put on a form but not clarified as optional. So again, something that may seem harmless may create a real barrier for families in applying and accessing care. And so lastly, I would just say, in thinking about access, and as you have this opportunity, I think, to really build off a lot of the strength that California has in its mixed delivery system. I think in looking at equity, we also talk about just thinking about what biases we bring when we think about access, in terms of what we emphasize and what we focus on and what lens we're looking through. And that we're hoping that this definition will really help in thinking about all of these other pieces as being critical to providing access and thinking about equity. Thank you.
Thank you. So before I follow up with a question, I just want to let you know that California did adapt your definition. So it was part of the work that we're doing with First 5 California on Quality Counts California. But then we also took it out as part of our preschool development grant needs assessment, where we have to define access to care. So we used that as our definition in the needs assessment. So you'll see it. Go child trends.
That is great.
So you mentioned a couple stats around expulsion suspension, and because that is something that we are all focusing on in California, how can we do better with collecting data around that? We don't actually have California-specific data.
Well, we found nationally that there's about 10 states that have implemented legislation specifically restricting discipline or suspensions, which includes preschool-aged children. I think one of the challenges a lot of times, the data that's collected is focused on the most egregious cases. And what we're finding and what we're hearing and what I think is trying to be improved is focused more on what we call soft expulsions. So I think part of it is having better data on attendance. Being enrolled in a program doesn't mean that child is getting the benefit of the day-to-day attendance at that program. But the other piece is also capturing better data on why children leave programs. So comments like it's not a good fit or did not meet the child's needs, may be other ways that you may be missing on expulsions that are happening in preschool. In Washington State, one of their strategies was to clarify the definition of expulsions. So when you call that parent to take the child home, that would count, right? So I think part of it is how we're defining it, part of it is the questions that we're asking, and part of it for early childhood in particular is just having really good information about when our children are in our programs and when they're not.
Thank you. One more question while we have you up here. Yeah. So as we look at California, we did have a very nice investment by the governor this year in $10 million for a cradle to career longitudinal data system. What advice would Child Trends have to California as we look at that? Sort of what would you offer as some best practices for that?
So I did not mention this in my introduction, but my role as the director of the Early Childhood Data Collaborative is looking nationally at states' efforts to integrate and use their early childhood data. One of our key recommendations that came out of our last national surveys, which I think is similar for California, is really a focus on governance. We found that states where there is a agency and coordinated focus on how to use these data, not for a particular program, but really at understanding the progress and how we're reaching children and families broadly in California, they have been more successful because you have an entity that's responsible for thinking through what those definitions are, how you fund and create actionable data for communities, for agencies, and for families. And it's having input from all stakeholders. So I think one of the things that we'd also recommend for California, understanding your system, is that for early childhood, thinking about how do you engage home visiting? How do you engage home Head Start? That I know this is birth to age 12, and I think for our framework and our recommendations is that it really starts prenatal. And so how do we think about working at a state level to have a governance structure, and we don't think of data governance separate from all overall governance, but that is our focus. But thinking about creating a body that has that responsibility, but also that authority to make those decisions. And I think, again, similarly, thinking back, and it's an opportunity to look at the system and whether the current system actually address those broader questions that you really want to be able to answer about early childhood services, about quality, about progress, about school readiness. And so I think our biggest recommendation is to really join at the state level, to work collaboratively with the support of those in local and state programs to think through how we can better collect and use our data. And then I think there's more technical things around unique identifiers, not only for child level, I would say also for programs. I think one of the key things, as I was saying before about our access definition, part of it is around what children is, and part of it is what children have access to. So having good data on early childhood programs, having good data on the workforce, which I know we'll talk a little bit about later, these are all key areas and recommendations that we provide to states, and we're looking forward to seeing California move forward.
That's great. So we actually did invest a little bit from our initial, I'll call it, our current preschool development grant on more local work, with Santa Clara County Office of Ed being our lead to collect some. And we're hoping with the next one having an opportunity to dive more on an ECIDS, an early childhood integrated data system, just like you said. So we would look at home visiting, and that's both at DSS and at public health, but then continue across the spectrum. So we're collecting IDA Part C and B, and really being more comprehensive in how we're pulling data together for action. Well, thank you.
Right, no, and I think the benefit is in states nationally we've seen that have done this. Once you begin looking at and using similar data, you start thinking more around how these programs and families are being connected through these services or not being connected through these services. So I just think an example of states that are really focused on making sure that children that are experiencing homelessness or children that are known to the child welfare system have access to early childhood as a key support. Being able to connect these data and working collaboratively have allowed them to see how they're doing this or not doing this, and then also moving forward, I feel like data cannot be a one-time thing. It's really about looking at progress, not about just sort of a snapshot of where children are. And I think thinking about your data system that way, and these data systems that states are creating, are helping to move more toward that.
Great, thank you. All right, so we'll move on to Mandy, even though data is one of my favorite topics, so Carly's questions will come up later. So an opening question for you is, can you provide an overview of the national perspective on early care and learning? And what differences are you seeing? Is there an uptick in more governors who are focused on this? And why do you think that might be?
Sure, thanks. So short answer, yes, there's definitely an uptick in governors talking about this. In such a partisan environment, early childhood still remains one of the few bipartisan issues that governors seem to be collectively coming around. So you'll see some data that this was provided by an analyst in our division who his main role is to kind of comb through the state of the states and state budgets and pull out common themes in education. So his work goes all the way through K-12 and higher ed, but I'm showing right here the early childhood priorities. As you can probably guess, pre-K access and expansion was the #1. You probably heard that yourself in listening to kind of the conversation around early childhood. And I'll come back to that, but if you'll notice the other kind of top issues, childcare quality and accessibility, we've already talked about that today and how that is an equity issue. Early grade reading, so early literacy is still a top priority, particularly in more conservative states. It's an easier issue to get behind in the early care and education world, and then early childhood workforce, which I'll talk about in a minute, is coming in close behind that. So to talk a little bit about the work that we've been doing, this is a map of the states in our what we call a policy academy, which is a year-long technical assistance program. The states in pink are states that came in through the Department of Education. So you'll see California is highlighted in pink. We partnered with CCSSO, which is the Council for Chief State School Officers, which works with state departments of education to bring in states that either weren't engaged through the governor's office or the chief oversaw more of the early childhood workforce than some other agencies may. So there's a lot of states highlighted, 16 total. This has been a 3-year project. This came out of the 2015 Transforming the Workforce and national momentum around improving the early childhood workforce compensation issues, career pathway issues. And so we saw a lot of states doing a lot of different things around trying to increase compensation in innovative ways, using WIOA funds, I believe you guys were doing career lattices and career compensation for that. And then states that are focusing on apprenticeship models. We just had our annual GEPA Institute, which GEPA stands for Governor's Education Policy Advisor. So in each state, there's a governor's education policy advisor who advises the governor on education issues. So that's our primary clientele, is kind of working with them and helping them understand early childhood through higher education. So those states that you saw were in that project. We also have another project going on right now called the Prenatal to Age 3 Policy Academy. That's another year-long technical assistance grant to governors' offices, just like the ECE Workforce work. And for these grants, we're really focusing on the common issue of integrating and aligning. So this includes data, but also at the policy level. So most states that you see highlighted here are doing a policy agenda specifically around prenatal to age 3 policies. So how can we integrate and align these programs? States are doing fiscal mapping, which was talking with some folks at my table earlier. You all have, from Learning Policy Institute a couple years back, you already have kind of a roadmap of where the funding from the federal level flows through the state and then goes to the different agencies and all the way down to the local level. Some states didn't have this, so they're working on that. A couple states are working on more tangible things, like an app for parents where they can go, and because babies don't come with an instruction manual as their tagline, so there's an app for parents to try to access the services that they may not know even exist, and even if they do know it exists, they don't know how to get to them. And on the back end for the state, and that state's Alabama, for that state, they're able to then see the data and kind of the areas within the state that are accessing services and the areas that are not, and compare that to need. So all these are equity issues and getting at the core of that. So just a few quick stories around how governors' offices are getting engaged on early childhood. This is Louisiana's Early Childhood Summit. This came through a partnership with NCSL, which is the National Conference for State Legislators. The governor's office called us, the GEPA, the Governor's Education Policy Advisor there in the center, Donald. He called us and said, my governor cares about ECE. What do I do about this? How do I get involved? So we partnered with NCSL to bring in a legislator who was an early learning fellow, which is one of their programs around ECE to get legislators involved in early learning. And we partnered, and then we held a meeting for state legislators that were interested in early childhood. It led to an early childhood commission that's been going for 2 years. There's a report coming out in December around the ways that Louisiana can increase access and affordability for families and how they can increase equity for birth. They call it the Birth Through 3 plan, but it's going to lead to larger early childhood birth through age 8. So that's one story. Another quick story is Montana's story. So Montana, Governor Bullock was the chair of NGA last year. Same sort of situation. They had a pilot pre-K program in a state that didn't have pre-K in a way that we might think about it before that, and he wanted to continue that program. So he had legislators pushing back on him. How are we going to do this? How do you do this in rural? It's not going to work here. So he said, I want to take those legislators, go to Alabama, go to a rural pocket and see how Alabama is one of the state leaders in pre-K, see how it's working there. And so that's exactly what we did. Brought him down there in partnership with NCSL so that the legislator could come, and they had a conversation with the Secretary of Education there on how this is working in the state and how it could work for Montana. So just a couple of ways that we help governors kind of understand ECE and then make connections between states, because even at the governor's level, every state's worried about how is my state doing compared to another state. We talked about here, you guys are more on the comparing to countries, but also, a lot of states are wanting to know around me, my neighbors, how are my neighbors doing on this? And you're going to hear from a neighbor after me.
Great. I'm going to do one follow-up question because we did participate in that work and got a lot out of it. In California, we did a survey to our workforce to look at their access to our resources and our professional development. And our big takeaway was we had invested too much in training, both through sort of the Department of Ed quality projects and through our Quality Counts California across. And so how do you instead move to stackable units that are actually degree bearing as we look at the workforce? So have you seen other states be successful in sort of creating more equity for the workforce in their quality improvement projects and doing things like stackable courses to lead to a degree?
Yes, definitely. So Washington has this model and had been working on and actually worked on a wage ladder for early childhood educators. And to get at the equity piece, I really want to highlight North Carolina, and not just because I'm from there, because they are having what they call their infant toddler wage stipend. They already have the wages program. I don't know if you guys are familiar with that. It's through the Teach National Center. It's a wage stipend for teachers who are considered high quality, working in a high quality environment, and so they can get a little bit more compensation through a wage stipend. But now they're targeting infant toddler teachers because we know based on what you've already seen today that that's the most expensive population to serve, but it's also the teachers are paid the least. And coming from being an infant toddler teacher, that's huge. So to have the opportunity to not have to kind of split the wage stipends with pre-K who are already getting paid more, but to have a chance to say, no, this is exclusively for infants and toddlers, we'll get at that.
Great, thank you.
You're welcome.
All right, so now we're going to move to another state. So Dana, do you want to open it up?
Yeah,
Oh, Dana,
hi.
I'm so sorry.
That's okay, Dana. Dana Banana, Rosanna Dana. So I am here to share with you what Oregon was up to this legislative session, really buoyed in large part by our Governor Brown, who actually acted as a champion for early learning this legislative session. We are proud to report. So we had a number of successes this legislative session. It was a really great year. We are going to offer a first home visit or 2 or 3 to every family in the state over the course of the next 6 years when they have a new baby. Thank you, very exciting. We didn't get much done on childcare, but we got a task force to come back with a plan to improve a very broken system. So that's exciting. We built on the success of California and Washington by passing the most inclusive Paid Family and Medical Leave Act in the nation. And we increased the earned income tax credit with a extra boost for families with infants and toddlers. So it was an awesome session, and I'm mainly here to talk to you about what I think is the coolest thing that happened this session, which is the Student Success Act. So the play button moves us forward.
Yeah.
Thanks. The Student Success Act is a $1 billion annual ongoing investment in education starting at birth, focused on eliminating disparities by race, ethnicity, language, homelessness, foster care status, disability, etc. Half of the new money will go directly to school districts, and their job is to identify how their district can eliminate disparities in their community, and they have to do that by talking with families and students who are in communities who have experienced those disparities. $300 million is going to some targeted state investments in K-12, like expanding access to school meals to reduce child hunger, specific investments in Native, Black, and Latino communities, career technical education, high school graduation efforts, et cetera. And then at least 20% of the money is dedicated to 0 to 5 early learning services. And this about doubles the state's investment in early learning in Oregon. I know you guys throw around billion here like it's no big thing, but your increase to education is like our entire state budget for 2 years. So $200 million is a lot of money for us. And all of this is paid for by a little bit less than 0.5% tax on gross receipts of corporations in Oregon. So no matter where the corporation's located, if you're selling stuff in Oregon, you have to pay that Oregon tax. And it has some deductions, et cetera, but this is an ongoing, permanent, dedicated funding stream. So that's really exciting. Woo-hoo. That's how I feel. So one of the things that was really cool about these 0 to 5 investments is that we took a really comprehensive approach to investing in the early learning system. And I have to admit, this was very overwhelming and confusing for legislators. They don't understand, and sometimes I don't understand, how we fund early learning. There are so many funding streams that have so many names. It can be very confusing. But we really made the case that we need to invest across the board and not in just specific areas. So it includes supports for the workforce. It includes 0 to 3 investments like early Head Start and home visiting programs. It includes investment in early childhood special education, early intervention. It includes the creation of a new early childhood equity fund for culturally specific early childhood services. And this is just a smattering of the coalition partners who stayed on the same page, stuck together, held hands all legislative session long to support this entire set of investments. I'll stop there.
Great, thank you. So you could hear the ooh. So I'm going to follow up on that a little bit. Revenue and finding additional revenue sources. I've asked for a magic wand and a couple money trees, haven't gotten them yet. So how did you get to that new revenue source? And do you have some suggestions or lessons learned for us?
Well, I have to say, I hope that in 2021, I am inviting John and Taryn to Oregon to one of our gatherings like this to tell us about how they fix their property tax system. So I'll be watching you guys. Go get it. There aren't many options to raise significant amounts of revenue, right? We're often talking about these tiny little one-offs. We passed more restrictive property tax restrictions than you did, and we stuck them right into our Constitution and the state. You know how Oregon feels about sales taxes. We have not crossed that bridge yet. And our income tax is the second highest in the nation after California, so that also felt like not like an obvious place where we could go. But we had the distinction of having the lowest corporate tax in the nation. So that seemed to be the opportunity, the place where we could go. The other thing I'll say is, in Oregon, everything goes on the ballot. So even if we had a bold legislature who was willing to do something somewhat unpopular and raise a tax that maybe didn't have public support, that's pretty risky because the bar to collect signatures and refer that to the ballot for voters to reject it is high. So we, as the legislature is crafting something, they have to be prepared that it's going to go to the ballot, and we have to be able to defend it. So the best tax in that regard is, of course, a tax that I don't pay from the standpoint of voters. And so corporate tax fits that bill as well as having the great talking point of having the lowest in the nation and corporations needing to pay a fairer share. We also had attempted a corporate tax increase on the 2016 ballot. The public employee unions took the lead on putting together a $6 billion biennial, so $3 billion a year, tax increase to shore up funding for any public service funded by the state. And that measure failed in an ugly, bloody battle. Everybody regrouped, kind of licked their wounds for a little bit. And early in 2018, the legislature decided to take a more focused approach, and they created a committee called the Joint Committee on Student Success, whose job was specifically to look at what we needed to do to improve outcomes in education. They started with a K-12 focus, so our first push was to ensure they included 0 to 5 in that focus. And we did that in partnership with the governor's office and the Speaker of the House, who's a great children's champion. The other piece of the puzzle was that, corporate tax wasn't the only thing businesses were debating. Paid family leave, also businesses had a point of view on that. There were some other things happening that put some pressure on businesses to come to the table productively on something. And this ended up being the thing that they felt like was probably going to move, whether they were in it or not. So they better be kind of at the table instead of just on the menu. So the corporate tax became the focus right from the beginning. So the Joint Committee on Student Success spent all of 2018 basically saying, what should we be doing in public education from birth through 12th grade to improve outcomes? Specifically not talking about how we would pay for it yet. Waiting until the November 2018 election was complete and supermajority of Democrats were elected in both chambers and the governor was reelected before cracking open the conversation on the specifics of how we were going to pay for the needed investments. And so then the governor released her budget, which we had obviously been lobbying alongside this Joint Committee on Student Success. She included a $380 million biennial investment for education, so almost everything that we wanted. So that then became the bar that kept us on the same page with our K-12 partners, who I think otherwise it could have been seen as a competition between early childhood and K-12 for the same pot of funding that was intended to do both. The governor kind of set the bar and said, okay, my target is $2 billion, 1.6 billion of it for 2 years. Sorry, I'm used to talking into your numbers. 1.6 billion of it will go to K-12, 400 million will go to 0 to 5. And so that really helped the K-12 partners be on board for the 400 million investment in 0 to 5. I would also say the state agency was a huge partner throughout this effort, and they were specifically sharing with us what requests they had put into the governor's budget so that if not all of them made it, we could still advocate on the outside knowing that there was a clear rationale. I guess finally I'd say we really tried to ask for what we were hearing families and children really needed, paired with what we thought we could, pushed ourselves to think about how much we thought we could implement. So not being having some realism, but not being too cautious about that, and kind of asking for as much as we think we could take, which I think is important in the early learning world, who isn't used to talking sometimes in the hundreds of millions or billions of dollar numbers.
That goes back to our ambitious yet achievable from our Race to the Top Early Learning Challenge days. Always make sure we can actually execute. So I heard a lot around leadership mattering, voting actually being a big part of what has to happen, coming together as a coalition and partnering, and not really competing, but making sure there's set-asides so that both sides are part of the solution moving forward. Carlise or Mandy, do you have any lessons learned or sort of bright spots where you've seen other states be successful in this? Around revenue or beyond the typical state general fund, how else are states getting additional revenue for this?
I can go first if you want. So we've seen states that are utilizing sin taxes or things like an education lottery, soda taxes. Arizona has first things first based off tobacco taxes. So basing things off of maybe non-sustainable is hard because then you can move things forward, but only for so long. So this is kind of ideal, what we're hearing from Oregon. That's kind of the ideal, to have your plan and then to be ready. We've had several states talk about a whisper campaign. They're getting ready, they're getting things into place. They're engaging the right stakeholders and getting buy-in, but then they're ready for the policy window to open when the political landscape is there. So just having the fact that California is making this ECE master plan at the same time as you have this open window is great, but for states who are not at that point and who are having to do a whisper campaign, that's kind of how we see things going. So Louisiana, for example, the funds aren't there yet, but they have to be ready for when that happens. So just being bold and being ready to ask for what you actually need, because as you can see and as we've seen today, it's very expensive. Early care and education is more expensive than K-12, and we're seeing the K-12 issues of underfunding and equity. So just being ready and being bold in that ask.
Really good points. And we will say, having worked at First 5 California for many years, and that was the predecessor before First Things First Arizona, we see the declining revenue. So there's good things, and no one's taken Camille and I up on our buy a pack, throw it away campaign. So there's that. We are getting some cannabis funds now, and I know other states are also getting additional cannabis. So Carlise, have you seen anything else?
Well, I was going to add from the data perspective, because
Yeah.
we focused really on, I think a lot of states struggle to how do you improve your data infrastructure, and particularly how do you fund that when you're trying to balance the needs to expand access, provide services, and professional development for our workforce. What we've seen is that states have done a mixture, again, getting back to sort of that shared vision and funding. We don't see these data systems as separate from the data that states are already collecting. It's really not about collecting more or shifting it, but thinking about how you're already using your administrative funds to be able to collect and document the services that are being provided. We've seen states leverage federal planning grants, such as the Race to the Top. I know California started some of their work there, but then also a lot of states are utilizing their preschool development grants to start doing more of that stakeholder engagement, infrastructure, planning, and governance work. North Carolina was successful in getting ongoing funding through their budget to support ongoing maintenance and updating for their data system. And again, thinking of that as really a support for how the state does their work. And I think that's really goes to kind of the leadership and the vision, but not as something separate. So how do you unduplicate maybe some of the foods that you're already using to streamline how you're using the data and then leveraging other sources for planning?
It always comes back to data, data, data. I would agree, being data starved, I'm always like, where's the data to help us make our story so we really know that we're using our funds well, right? So that's part of it. We have in California, I think, it looks like a really big number, but as you saw from the number of children we're able to reach, it's definitely not enough of an investment. And yet, how well are we using the dollars we have now? So have you seen other states really tackle their current use of funds as part of their governance or through the preschool development grant, and then say how they can actually invest those in a way that leads to better outcomes?
I'll just add a quick example first that we saw in Pennsylvania, again related to their data system and how they sort of started their initial development. So Pennsylvania has their Pelican system, so Pennsylvania's enterprise to link child information, but it really came from a need to make sure that they were quickly getting children in slots as they became available. So I think similar to California, you have this challenge where we have different funding streams, different eligibility. So a child may be eligible for one slot but go into another, and how do you quickly fill that slot so those funds are not going unused when you know that there's such a high need. So they really first connected their child data to be able to quickly provide services to children on their waiting list. They started with their subsidy program, they expanded to their preschool, added Head Start, and really kind of took a phased-in process to really help them better allocate their funds quickly and to the areas of the greatest need.
And I'll just note, there's some connections that can be made to the K-12 world, because there's funding in K-12 that can be used for early childhood in innovative ways. So in Kentucky, they do what's called a superintendent's toolkit. They bring together all of the superintendents in the state. They've done this for about 3 or 4 years now, and they have those superintendents, in order to come, they need to bring someone from their Head Start in the local community. They need to bring someone from a community-based organization providing childcare, family engagement, and so they bring these teams to the state level, and they go through what's called a superintendent's toolkit on early childhood, so that you have your superintendents kind of bought into early childhood early on, because we know that for a superintendent, their tenure is short, and it's hard for them to focus on early childhood, because early childhood, sometimes you may not see the gains immediately. There's no testing, there's no, I can wave these test scores around that I've succeeded in early childhood. So it's getting that buy-in at the superintendent level. We see that also in Nebraska with their Sixpence program, where they actually are using their K-12 funds for home visiting. They're making the school the center of the community, because they know these may not be my kids right now as a principal or a superintendent, but these are my kids and these are my families. So they're using those funds to do home visit to the families that are in their community.
That's great.
Can I add too? I think this question of ensuring we spend money wisely is an important question. Obviously, we want to be good stewards of the public funds. And before I worked in early childhood advocacy, I spent about a decade working in K-12 advocacy. Before that, I was an elementary school teacher. And we also just need to get a lot more money in order to make our investments matter. And so one of the things that more money. Just one example of that, legislators in Oregon have a huge commitment to Oregon pre-kindergarten, which is the state's investment in the federal Head Start program. And we put more money into the federal Head Start program than the feds do in Oregon. It's a really big commitment of our resources. And those teachers are earning an average of $29,000 annually in those classrooms. And so when we were talking about expanding access to quality early care and education, one of the things we said was, we literally can't hire more teachers if we continue to pay them $29,000 a year. So even if you gave us the money for slots, we can't serve any more kids, because we don't have the classrooms and we don't have the teachers who are willing to basically be eligible for Head Start in order to teach at Head Start. People with 70-80% of these folks have bachelor's degrees. So that new Oregon pre-kindergarten money that was on that slide, that $40 million, the first priority for that money is to raise teacher salaries to be comparable to kindergarten teacher salaries in Oregon. And I say that because I sometimes think getting the value for the investment that we're making actually means spending more per child. And I know you guys know this, but I just think it must be said, and we have to remind legislators that to get those, I think, Kim maybe named it at the beginning of the show that, Abecedarian and Perry and Chicago Parent Child, they're spending $25,000 per kid on some of those programs, and that's why they got the huge return on investment. And a $2,000 or a $5,000 or an $8,000 pre-K program might not get you that return on investment. So if you want the long-term payoffs, if you want your investments to yield, you have to invest enough on the front end to do what's right for kids and families.
That's great. So I'm going to do a quick shout out because Assemblymember McCarty just walked in. And of course I don't have my glasses on, so. Oh, there you are, Kevin. So welcome. So when we think about champions and people who've really invested both time and sort of thought process and teams to addressing early learning and care, looking at expanded learning services across California and really connecting them all, Assemblymember McCarty is one of our champions. And he joined on a preschool study tour last December where we went to visit some states. And some of the things you're talking about, Like in Remembering New Jersey, they had the superintendent there from the local schools, I think 2 of them came, and said how important it was for them to engage with their local Abbott preschool programs because of how important that pipeline was and their transitions for children as they went across. So thank you so much, Assemblymember McCarty. You have brought lots to us, and we're really grateful that you're spending a few minutes with us today. Thank you. He actually could add even more than I can, so I'm a little, if you want to come up here and do this. No. We did learn a lot on that tour, though, so I think highlighting some of what you've said around the investments and how much you need to sort of to tip the scale at quality, and I think it was you, Carlise, who mentioned that states are having to look at the cost of care now as part of their Child Care and Development Block Grant. It's no longer just looking at the regional market rate, but we're actually required to do a second survey that looks at the cost of care. So one is a regional market rate where what can people actually charge, and then you get into the private pay, which is something we always sit with in my office, of how do you address private pay families, knowing that my staff are all private pay families, and most of the market is actually private pay. So wanting to hold that in one hand, and yet knowing that we're still not addressing the true cost of care with that. So is that something that you've seen other states grapple with? What sort of things have they done with their regional market rate or with sort of subsidies and other dollars to make it accessible not just to families who are on the subsidies, but to everybody in communities?
I can start if you want. So the first thing that comes to mind is early Head Start child care partnerships. Just this whole idea of bringing in the private institutions in with Early Head Start. I was on the National Center kind of providing TA for that when those grants came out, and it was scary. If you're a child care provider and you've been operating in the private market and you're barely getting by, and now you're asked to adhere to Early Head Start standards, that's a lot. Same thing with family child care. There was 500 family child care partners just in that first couple years of these grants. And that's a lot to be coming into someone's home and saying you need to meet Early Head Start standards, which is kind of the most rigorous that we have, example of quality that we have. So, but it made such a difference to see the evaluation of those programs and the difference that it made in kids' lives. The great thing about the EHS-CCP, the Early Head Start Child Care Partnerships, is that even the kids in those private child care centers who were not eligible for Early Head Start, maybe they were private pay, they got what we called the spillover effect. So they got the quality that's set with Early Head Start without necessarily being eligible for the program.
I love that you called that out because we are actually one of the states that operates an Early Head Start child care partnership. And one of the things we've seen in our office in that partnership is the elevating of quality within a community, because we often are in these rural, more isolated locations with family child care providers. And you're right, it's not just the children that are in there with the subsidy dollars. It's that broader piece, and then those family child care providers working with all the families, and then working with other providers in the community. So it is a ripple effect in a really wonderful way. And Dan, I saw you nodding at that.
Yeah, I think that's a great example, and we had some exciting Early Head Start child care partnerships happening in Oregon, and with the latest increase of CCDBG funds from the feds, Oregon's also piloting a contracted slot strategy for infant and toddler child care as a spark to system reform. And so it's looking, this investment of child care dollars are looking a little bit more like our state pre-K investment and kind of piloting what it would look like if we did a subsidy system actually well in a way that worked for providers and for families and children. And so, so some of our dollars were basically hiring child care providers to have a certain number of their slots available to low-income children whose families are eligible for the child care subsidy program. And we're paying them what it actually costs. Well, not quite. We're paying them like $18,000 per year per child, which compared to the $13,000 or $14,000 that our subsidy rate will pay. So boosting the pay without it impacting what they charge their private pay families. So I think that's one kind of workaround to that market-based system. We're embedding in there, in the contracts with providers, some efforts to increase the pay of infant and toddler teachers, similar to how we've done with our state pre-K program, and now we're moving toward doing with our state investment in the Head Start program, and embedding additional professional development focused on the care of infants and toddlers specifically. So I think, you know, fixing childcare in America is a very complex question. It's going to be a state, federal, local partnership. There's a lot of work to do on a lot of fronts. But I think embedding contracted slots as a piece of your system is a good opportunity for a state to move forward while you're working on catching the subsidy system up.
Now I feel like I planted you, because that is actually something that we've been talking a lot about. So we do have contracted programs, but as we look at more rural, isolated communities where they may not be able to support a whole center program, that has come up a lot in our conversations around how that might work. And the Preschool Development Grant provides an opportunity to pilot a few things as well. So thank you so much for sort of blending that in for me. And I can make eye contact with Stephen Profiter, who's our new director of the Early Learning and Care Division at the Department of Ed. So he makes sure he gets that in there. Always interesting as we look at different ways to support and encourage, especially because California has a huge lack of access to licensed care, actually to any care in a lot of our communities, especially in the rural isolated. So thank you. Carlise?
Yes, and I would just add, in terms of our survey of states and their approach to increasing rates, I would just say in terms of the outcomes, we don't necessarily have exactly all of that information yet. I think this is an issue that a lot of states struggled with, but I think what we've been seeing current approaches is sort of what my other panelists have said, where states have attempted to increase their rates a certain percentage based on the funding they had available, and we've seen them incentivize rates for care where there's the greatest need. So we've seen increased rates for infant toddler care and home-based care where they're seeing the greatest utilization and the greatest need. We're seeing increased rates based on levels of quality, based on their rating and improvement systems. I think it's unclear how that rate increase relates to increased quality and increased compensation for staff, right? So I think that's sort of the piece that still states are working through, but as a first step, they're really thinking about how they can use the rate structure to incentivize the types of care that they're seeing that parents are needing.
Great, thank you. So I think we will transition over to sort of general questions, so it's not just me, but having the rest of you be able to ask a couple questions of our panelists as well. I'm guessing there's a mic somewhere. If not, you can shout them out. Okay, great. Does anyone have a question? Do you want a money tree in your backyard as well?
That sounds great, Sarah. Peggy Pizzo from Stanford Graduate School of Education. Are there any states that are using a combination of contracted care and voucher finance care to really improve both access to and quality of infant toddler care? And if not, why not do it in California?
So Peggy, you said it was a voucher and a contracted together?
Yeah. Mm-hmm.
Can you describe that a little bit more? So how does it work within, is it within the same slot?
Well, I don't know if it's being done anywhere, but, you know, why not envision a possibility of bringing contracts to networks of family child care providers who are financed primarily through vouchers, and bringing the best of the two systems together, the stability of contracts, the ability then to leverage supports to the providers, mental health related or other health related or child development related supports, as well as provide the non-traditional hour care that's extremely important and needed, and do this in a way, and here we're stretching, I know, Sarah, but maybe we can envision again, provide something maybe in a mobile way into rural areas as well. So, I mean, it's just a kind of dream of mine, I guess, ever since I was at 0 to 3, and I'm just wondering if anyone has seen it happen anywhere.
So, yes, Carlise.
I was going to say, I do not have the exact states, but could follow up with you. But we have definitely seen with the increased child care and development block grants, states, and with the expanded percentage focused on infant toddler care, we saw a lot of states that were focusing on developing infant toddler networks and family child care networks to not only help build the pool of infant toddler care, but also create networks around providing additional professional development supports too, locally and then also at the state level. So I'd be happy to share what states reported that.
Okay, great. Thank you so much.
Good morning. Congratulations on all the good work that you're doing to improve the, bring up the floor for all children and staff and programs. I'm particularly interested in knowing what you have seen and what has worked to shore up the inadequacies for dual language learners, children, families, teachers. The gaps in funding, bringing the universe up is good, but the deficits that exist for dual language learners, the equity issues, the quality issues, the staffing issues, the access to other resources is something that's really big in California. So what are your lessons?
I would say in Oregon, we do not have that nailed yet. We have a really visionary leader at our early learning division, Miriam Calderon, who definitely has a commitment to supporting native language development in early childhood programs, and so it's something we're working on. I do think the creation of the Early Childhood Equity Fund, which was led by Latino Network, which is a culturally specific service provider in Oregon, who runs early learning programs that are community designed, that were mostly shut out of receiving state funding streams because they don't meet those state or federal mandates for quality, right? They're not running Head Start classrooms, they're running Spanish language parent-child interaction groups and parenting ed and the stuff that parents told them that they wanted to see happening in their communities. And so I think that equity fund is one example of a way that culturally specific programs are getting a foot in the door into the state systems and will now be state-sanctioned, state-funded providers of early care and education services. And that will help inform what Latino Network on the table of culturally specific providers they've convened always reminds us is this is not the funding stream for kids of color. All the funding streams are for kids of color, and we need to make sure they're all working for kids of color. And so I think Oregon at least has a lot of work to do in that area, but I think bringing the culturally specific providers in to the official system with a funding stream that's flexible and responsive to communities is an important step led by leaders in communities of color to make the work that they're doing official, recognized, funded by the state to continue that work and to influence the way that the rest of the funding streams are implemented. The second thing I'll say is with this new investment, both K-12 systems and early learning systems, the charge from the legislature was close academic disparities, right? It's not just a fund for all. And so they're mandated to have conversations with parents and providers who reflect the communities who are being underserved, excuse me, and demonstrate to the state, demonstrate to the state how how their local investments are reflective of what parents said they wanted. So we're working right now to figure out how to ensure we hold communities accountable to following that mandate. Excuse me.
And Antonia, so you know that this is something we all share as sort of like a joint passion area in addressing it. And in California last year, the legislature dedicated $5 million in our CCDF quality sort of one-time funds to supporting dual language learners. And through that, we had a partnership with a few. I know I saw Anya for a brief section. So with the Sobrato Family Foundation, with Lupe Jaime and Fresno and Matilda, expanding some of their work around dual language learners, and then with Carola Olson in developing a course specific to supporting dual language learners. And really our push and sort of our charge to higher ed is how are we ensuring that any language development or language and literacy course fundamentally addresses supports for home language and then builds off how are you supporting children who are also English learners. The majority of our children are. So it should be part of those required courses. I would love if it became part of our child development permit matrix and really was embedded, knowing that those are our children. So looking at ways to not just have to do ongoing professional development, but actually embedding it in coursework, I think would move us a long ways. And ultimately, if you look at the English learner roadmap that the department has and really hold that up as something that the state board has adopted, and for other states, that is California leading the way. So thank you for everyone who made that possible. And the Global 2030 initiative. So how do we get to a California where all of our children are coming out bilingual? And what does that mean for our workforce, where we then have to make sure that all of the educators themselves are bilingual and know how to support language development in English and in another language. So huge goals, but that is where California can make a difference, right? We're now the 5th largest world economy. Well, what's holding us back from being the 4th? Let's move forward, let's use that as an asset and really say we are part of an international market and our workforce can speak in multiple languages and has the brain development behind it, those assets to move us forward. Sorry, that was my pro-California little. So we have a couple more minutes and then Chris Perry should be getting here. So are there any other questions for our panelists?
I have a question. So specifically, and take another drink of water because I'd love to hear you, if you can talk any more at depth around how you supported the K-12 and the ECE sector from not fighting against each other and operating in silos, but to both get behind the corporate tax. And I'd love to know if other states have done anything similarly to really, as I know California is continually working to do, to support this educational continuum and to keep us working together instead of competing against each other for these much needed resources.
So one thing that we did that I don't know if we knew at the time how important it would be, but it turned out to be really important was we had spent a year working in collaboration with our Superintendents Association to build superintendent knowledge and understanding of high quality early learning leading up to the 2019 legislative session. So they had 3 work groups that were each looking at an area that emerged from superintendents as important for them to learn more about. One was diversifying the workforce, one was connecting health and education, and one was early learning specifically. And Children's Institute had staff people sit on each of those work groups because they're each relevant across the early learning to and up. So we worked monthly with them where they would have full day meetings with superintendents from all over the state who would be convened in one space, and we would work with them on the agenda for those meetings. We would recruit the panelists, we would prepare the panelists, we would provide presentations. And so by the end of that time, you know, I think they had looked at our state pre-K investment at $12,000 a kid, and they said, well, gosh, that sounds like a lot, $12,000 a kid. And I said, well, wait, that includes meeting ratios, that includes all your facilities costs, that includes, you know, we don't get Title I funds or any federal, you know, backfill. This is an all-inclusive number, so you can't just put it next to the K through 12 per child allocation and compare them directly. They are very different kinds of numbers. So we spent a year really educating the superintendents on the early childhood funding streams, the cost per child needed to drive quality and the outcomes that they care about, right? Kindergarten readiness, 3rd grade, and long-term high school graduation and beyond outcomes, making sure that they understood why it was important to spend enough per child to result in a quality program and those outcomes, and making sure they understood the significant lack of access in the early childhood space. And I think because that Superintendent Association, their executive director and their lobbyist are meeting every week with the Teachers Union, the School Boards Association, the School Employees Association, and the K-12 lobbyists, they were a really important part of building support among the whole K-12 community. I think there's also, because our state pre-K system is a mixed delivery system, some of those state pre-K classrooms are in school-based settings, some are in home-based settings, some are in center-based settings, some are in Head Starts, et cetera. And so an increasing number of teachers union members are preschool teachers, and in fact there are 2 preschool teachers on the teachers union board of directors. And so I think that's another important evolution in the reality that pre-K is sitting at K-12 schools, that some of those pre-K teachers can rise up and become leaders within the union and be an internal voice to help shape an early childhood agenda in that arena. And then, you know, of course, we did a couple presentations to the School Boards Association board as well, just kind of keeping like fertile ground and positive relationships there. And then, you know, like I said earlier, I think the governor setting the bar that this was going to be a birth through 12th grade investment, and making sure that that birth to 5 got a meaningful investment, that, you know, it was that, I can't remember the phrase you used, but basically a stretch goal but achievable, was another critical factor. Because I think then if K-12 came in and said, no, 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 they're only going to get 300 million or they're only going to get 200 million, they just would have looked politically bad. So I think that was helpful as well, honestly.
Just to add another piece really quick, just trying to get that understanding of policymakers, particularly a governor's office. A governor's #1 concerns are economy and well-being of the citizens in the state. So education is linked to that so closely, and although we don't have these education governors anymore, like we saw historically, we have a lot of governors that are focused on education and understand the link in the pipeline to the workforce. So just making sure they're, you know, that's getting, and the first priority for them is understanding this is the future economy. 2 out of 3 families, both parents are in the workforce, so your childcare community affects your economy so much. So just making sure that they understand that. That's partly our job, working with governor's offices on education, and then all of our job collectively with policymakers.
Great. So I want to have you all join me in thanking our panelists. Thank you.